of course, pharmacists are involved in educating other health professionals about medicines. Okay, they educate other health professionals about medication use, medication prescribing, and other drug use processes. So when it comes to medicines, we are known to be the people who know all there is to know about medicines. We are the ones who have been given the right to teach patients on their medication use. Unfortunately, and fortunate enough, we also know more about diseases. Therefore, as pharmacists and pharmacy students, we're supposed to teach the general public about diseases, about medication use. Okay. Now there are many diseases that we study. Okay, we study of infectious diseases, those diseases that are caused by microorganisms. We also study diseases that are non-infectious. Okay, there are no microorganisms involved. For example, look at diabetes mellitus, look at cancer, okay, hypertension, heart failure, and so on. Those are non-infectious diseases. They are non-communicable. There are no microorganisms involved in there. But as pharmacists and also pharmacy students, we can teach the general public on how to avoid those diseases. Exercising, no alcohol consumption, no smoking, okay? Avoiding all risk factors that can cause those diseases. And when it comes to other diseases like infectious diseases, okay, sexually transmitted diseases, tuberculosis, COVID-19, and so on. For infectious diseases, we can teach the public on how to avoid those diseases. Now, listen, you as future healthcare professionals, pharmacists to be, you have authority. When you talk of diseases or medicines, the general public will listen. Amongst your friends and families, not everyone is in the healthcare profession. Even on your social media, your Facebook page, your WhatsApp, if you write anything to do with medicines or diseases, most people are going to listen. Talk of COVID, talk of TB, talk of hypertension, talk of heart failure, and so on. If you write anything about those diseases, people are going to listen. And remember, your role is to teach patients. Your role is to teach the public about medicines and the diseases. So as pharmacists and pharmacy students, it is our role to teach other healthcare professionals, the general public, about medicines and diseases. And when it comes to disease, like I was saying, there's disease prevention, there's disease control, and there's disease management. Okay? Also, pharmacists and pharmacy students, they participate in disease surveillance, okay? Disease prevention and control strategies. How do we control diseases? What strategies do we put in place for us to contain a certain disease? It is our role. So when we talk of surveillance, it's simply disease monitoring. How do you monitor a disease? You start looking at the source of a disease. What is the source of this disease? Or what are the risk factors associated with this disease? How do we prevent them? And how do we control this disease? That is a brief introduction to public health. Any contributions or any questions? If there are no contributions or no questions, it means it is clear and the lecture is done. Okay, so by definition, when we're talking about public health, this is a study in which we look at the prevention of diseases, prolonging the life of a patient and improving the quality of life. So improving the quality of life by ensuring that people follow certain informed choices in society, in organizations, or in communities. So we are saying, how do we improve the quality of life? How do we prolong someone's life? And how do we prevent a disease? Of course, people have to make informed choices. If you are told to say, if you eat too much fat meals, you're going to have a cardiovascular disease, you need to make a choice. Okay? You need to make a choice whether to continue eating or to stop. If you continue eating, one day you suffer from a cardiovascular disease, and that's what's going to take your life. We help people prevent certain diseases by warning them about the risk factors of diseases. Once that is done, we are going to help people live a longer life. Their life expectancy is going to increase. Okay, so in public health, there are many specializations that lead to disease prevention, prolonging of life, and also improving the quality of life. So we have epidemiology. So there are people who are specialized in epidemiology. You find that there's maybe public health, a master's of public health in epidemiology, a master's of public health in microbiology. Again, you find biostatistics in public health. Of course, you guys also did. Of course, you guys also did biostatistics at your 4th year level, and you also did microbiology. You've done you did epidemiology, you've done microbiology in your 3rd year. So all these disciplines, they still continue and they are part of public health. Okay, there is law in public health, there is health promotion, and so on. So there are many disciplines in public health that help with disease prevention, improving quality of life, prolonging life. Also, they help in disease surveillance and so on. So the major thing about public health that you must know, and for all diseases that you've covered from the time you joined the University of Zambia up to now, diseases that we've taught you and diseases that we've not taught you, you must know how to prevent those diseases. That is the backbone of public health, disease prevention. Okay, disease prevention. What strategies can we put in place to prevent a disease? What strategies can we put in place to control or contain a disease? That is public health. So in pharmacy, for example, there are issues to do with side effects, adverse effects of diseases, okay? Sorry, side effects and adverse effects of drugs. So in pharmacy, responding or controlling those and preventing those adverse effects is our role. Okay? Severe adverse effects can lead to death. So it is our role as pharmacy personnel to ensure that we prevent any death that is as a result of adverse effects of a drug. So we look at the general concepts that will come across in public health as we will be practicing and as we want to do certain things in our profession. So as you start practicing, even now, and in your epidemiology, I'm sure you came across the weight, incidence, attack rate, and so on. So in simpler terms, incidence, what I can say, like incidence. Today, if they report COVID-19 cases, those new cases of COVID-19, that is an incidence. So if they say today the new cases are 1,500, it means the incidence today is 1,500. Now you take into consideration the population. So per population usually is put per 100,000. So the incidence is simply the new or the new cases of a disease. That is incidence. Let me give an example. I should have, if I should have taught this part in fourth year. Let me give an example here. Incidence. If, for example, you went for Matebeto, and at Matebeto, they prepared the munkoyo, okay? Munkoyo, or tobwa, or something. So they prepared munkoyo at the Matebeto. And you people who have attended this function are 2,000. And all of you partake of the Matebeto munkoyo. So after taking munkoyo, you decide to go home, okay? Now, from all the people that attended Matebeto, that is the population, right? So all the people that attended Matebeto, maybe 40 of them suffer from diarrhea as a result of the munkoyo that they took, okay? So they suffer from diarrhea, 40 of them. So the question is, these people attended Matebeto and they suffered from diarrhea. So we assume the munkoyo is the one that has caused this. And they are told to say, calculate the incidence. Okay, meaning calculate the number of new cases, new cases, okay, of the disease as a result of munkoyo. So how many people developed developed diarrhea? There are 40. Out of the total, 2,000. Okay, then you multiply this by 100 to make a percent. So how many people, therefore, what is the percent of the people that developed that? 20 into 40 to get a 2. So we're going to say 2%, okay? 2% of people developed diarrhea as a result of taking munkoyo. So incidence can be expressed as a percentage, or you can express this in terms of population. So 40 people, we said you express per 100,000. So 40 people per 100,000 population developed diarrhea as a result of consuming munkoyo at the Matebeto. Any questions there? Hello?
No question.
No question? This will be a simple question then. Okay, close. So we're talking of new cases of a disease per 100,000 people. Now, in outbreaks like the one we have, COVID-19 outbreak, this incidence is expressed as a cumulative incidence because there are a lot of people who, of course, suffer from the outbreak. Hello?
Yes, I wanted to ask about the same. So if you calculate it in percentages, is it incidence or incidence rate?
If you calculate in
percentages,
mm-hmm.
Yeah, is it just called incidence or incidence rate?
Okay, yeah. So you can express the incidence like I was saying, per population, okay, per 100,000 people, or you can express it as a as a percentage. Now, if you say rate is time, okay? Incidence rate is time. So if you include rate, it means you're including maybe per year, okay? So you can just calculate like it was 2%. You just say 2%, the incidence of the disease is 2%, or it's 40 people per 100,000 population. It's the time you are going to add rate, it means there's a time associated with that.
Okay, sir.
Yeah, so in here, there's no time, so you just leave it at the percent. Now let's look at the same incidence or cumulative incidence if it is in an outbreak, for example. So here we're looking at the number of new cases of the disease per population and per time unit. So Chris, now this answers your question. If you have new cases in that population and per time, it becomes a rate, okay? So there's a rate because of the time here. So now we have COVID-19, we can calculate the attack rate. You can use, if you want, you can try to use today's statistics and come up with the attack rate or the cumulative incidence, because we are living in a time where we have an outbreak, okay, and we expect the cases of COVID-19 to increase. So the cases are quite high. So we have to calculate the attack rate. So there we have to include the time. So we have to calculate, if you find maybe 500 people per 1,000 population, okay? Per 1,000 population, now you include per year, okay? So we can look at the maybe nowadays we do it per day. We say 1,000 cases per 100 people per day, because they are calculating that per day, the new cases. So these are just basically some principles. Of course, you should have done this in epidemiology, and then we build up in public health in 5th year. So incidence, attack rate. So I'll also prepare a tutorial sheet where we can calculate each one of these, the incidence, the attack rate, and also the others that we are looking at. Look at this example. The incidence rate of syphilis in Africa is 500 per 100,000 people per year. Okay, so we're saying the new cases of syphilis in Africa, it's actually 500 per 100,000 people per year. That is an incidence rate. Then we also have what we call the prevalence. The prevalence, when it comes to a disease, we talk of all the cases, new and odd cases, new and odd cases, all the cases. Okay, that is prevalence. All the cases of a disease. Share, board, delete. So prevalence and incidence are very important, and I like them. I like people to understand how to calculate these two, because people usually interchange, okay, the two. So take note of this difference. For incidence and prevalence, so incidence, we are talking about new cases only, okay? But prevalence, we are saying both the new and the odd cases divided by the total population, by the population. So then he knew divided by population. So if you want to understand incidence and the prevalence, that's what you do. Incidence, we're looking at the new cases. Prevalence, we're looking at the odd cases. So let's look at those people who went for Matebeto. 40 people developed diarrhea, okay? That is on day 1. On day 1. On day 5, 40 more people developed diarrhea from the same group of 2,000. So on day 1, we can only calculate the incidence, right? We can only calculate the new cases. But on day 5, we can calculate both the new and the odd cases. So on day 5, we have the new cases, okay? And there are also some odd cases. So to calculate your prevalence, you add 40 and 40, that's 80 over 2,000, find the percentage. But on day 5, if you are told to calculate the incidence, you are only considering the new cases. You're forgetting about the odd cases. So just use, for incidence, use only the new cases and forget about the odd cases. Okay, and use the same given population. If it's 2,000, use that 2,000. But if some people have died from that 2,000, don't include those that have died. Only use the people who are alive. Are we together here?
Yes, sir.
Yes, sir.
So
just repeat the part where you said of like the when there are people who have died. I didn't really get you.
okay, so I was saying, if, for example, you are calculating certain percentages like incidence and prevalence. Of course, we're talking about the cases of a disease. So if these guys were 2,000 and 10 of them died, so we are remaining with sorry about this, cancel this one. We're remaining with 1,090. So this is the new population. We'll not consider the old population. So we only consider these who are alive. Okay. Because others have died and we are not considering them in the calculation.
All right, sir. Thank you.
Yeah. But the principle there, you need to understand about incidence and prevalence of a disease is that incidence, we are considering only the new cases of a disease and the given population. Of course, the population is given, whereas the prevalence, we are looking at the new, new cases and the odd cases. Everyone who has a disease, whether it's a new disease or an old disease, everyone who has that disease, and then the total population. Okay, and it can be given as a percent as well. For example, in Zambia, it is stated that there are approximately 25% of people who have tuberculosis. That is an approximation, and that's a prevalence. Okay, it means everyone, all those who have new cases of TB and the odd cases of TB, they are included in here. Okay. Then there's also another term that we call morbidity. Morbidity is about the prevalence as well. It's about the people who have the disease. Now, morbidity goes into details. It goes on to say the effects that the disease is going to bring about. For example, if you have a disease, okay? So we are saying you have a disease, yes. But if you have a disease, that disease will make you incapable of doing certain things. Maybe you'll be bedridden. You cannot work. You cannot do anything, okay? Because of that disease. Maybe you become disabled as a result of the disease. So morbidity goes into detail to talk about the people who have the disease and how this disease is affected So how this disease is affecting them? They cannot work. Therefore, they cannot produce for their families. Okay, so that's about it, morbidity. So people have got a disease, and this disease has made them incapable of doing certain things. Then there's also lethality. Now here we're talking about people who have the disease, okay? So lethality now, let's look at COVID-19. There are people who developed COVID-19. Of course, some people recovered, but others died, okay? So those people got COVID-19 and died from it. In public health, when we are doing statistics, we call that as lethality or case fatality or case fatality. So some people will get the disease and eventually they'll die from it. And I take you back to your pathology, etiology of a disease, as well as natural history of a disease. When you get a disease, etiology of a disease, when there's resolution or when there's an outcome, there are two things from the outcome. Resolution, you get well, you recover, or you die. So those people that die from the disease, those are the ones we're talking about. They get a disease and they will eventually die from that disease. Also, we talk of mortality. Every day we've heard of COVID-19, we reached at 82, 72, 60 something. I think today it must be 20 something or 30 something, but it's been reducing over time, and it's because of trend rise in temperatures. So as we go towards the end of July and beginning of August, the cases of COVID-19 deaths are going to they will keep on reducing. And in August, actually, we are going to be recording a zero mortality rate associated with COVID-19. September, there'll be zero. October, zero. By November, zero. December, again, we are going to have new deaths as a result of COVID-19. So the number of people that die of the disease per population, usually the 100,000 population, that is called the mortality. If we include a year or a time frame, then it becomes mortality rate. Okay, so the mortality rate of COVID-19 in 2020, we have the statistics. So when you attach a year, please go on.
I think in other definitions, they say mortality is the number of deaths per 1,000 population. Is it still correct, or we have to always use the 100,000?
No, it's still okay.
Okay.
Yes, it is still okay. No, when you say per 1,000 population or per 100,000 population, what it means is that you assume that per 1,000 people or per 100,000 people, that per 100,000 people, this number of people died. Now, if you have 1,000, you say 4 people died per 1,000 population. It means that when you get 1,000 people, 4 of them died. So by the time you go to 2,000, you say 8. 3,000, it means 12, just like that, okay? So in other, there are different or multiple definitions of all these, but the catchword here, we're talking about the number of deaths, okay? So the catchword, we're talking about the number of deaths. I think in third year, I also taught you I taught you on the national health policy, and I think we had some definitions on mortality and so on. I think you can look at that as well. So you'll find maybe different definitions that come into play. Then you also have proportional mortality, and the number of people that die from a certain disease. Like here we can have, you can have a national mortality, like just mortality in total, people have died. Then we say proportional mortality, just COVID-19 alone. How many people have died from COVID-19? That is like proportional mortality. So you are just considering one mortality aspect being caused by a particular disease, okay? And when it comes to mortality, that is associated with infectious diseases. It's a global problem. It's not like in Africa, it's not like in Asia, it's not like in America. It's a global problem. Every continent, every country has got deaths as a result of infectious diseases. And now the deaths that are being recorded as a result of COVID-19, which is an infectious disease, actually is affecting every nation. So when we talk of mortality and when we talk of diseases caused by infectious diseases, it's a global problem. Okay, so long time ago, there was no public health, of course. You know, everything starts from somewhere. But there were issues, for example, when someone got sick, maybe they have a flu or they have a contagious disease, maybe they'll be isolated. They'll be told to be staying alone in a certain room. Okay, they will be isolated. You have flu. We've realized that when you develop a flu, it will be transmitted to another person. So when you have a flu, you have to stay in your own room. That was the concept of quarantine. But by then, people never used to call it quarantine. Okay? But later on, like in the 19th century, you find issues like to do with hygiene, sanitation, cleaning water for drinking, looking at better ventilation and so on. All these things now started falling in place. And by then, these were called population health. Okay, still the term public health was not coined. So we're saying certain things just started naturally. They look at the source of a disease and say, okay, you'll be isolated until you're well. Even now, the issue of isolation or quarantine is still here. Issues to do with good ventilation, like maybe they used to make houses, but without windows, without ventilators, and so on. But these things started falling in place with time. And the problem with those days, when public health was being developed, the concentration was so much on infectious diseases, forgetting about non-infectious causes of diseases. Okay, so issues to do with safety at work, vaccines, food control were developed, and we are also using these things as at now. This issue, because concentrated so much on infectious diseases, it is referred to as the classic public health. Okay. Issues to do with promoting better education, better housing, looking at large populations, political movements, and so on. But that started changing, and now we are in what we call modern public health. So in modern public health, we are looking at people as we're looking at people. Now we are considering an individual. If you have to prevent a disease, look at an individual. Wear a mask. It's an individual choice. Wash your hands. It's an individual choice. So we're looking at things that each one of us has got an influence on. Smoking, it's up to you. Eating habits, it's up to you. Drinking, exercising, sexual health, tanning, wearing of mask, social distancing, and so on. All these are choices that we can make on our own. Due to time, we are going to end on slide number 10, just here. Until we meet next time. Sorry, I couldn't make it in the morning. So we meet next time when it's time for